Hello everyone, I hope all is well. Hope you're taking care of yourself and those around you. We're back with the second shave in the Aqua Velva series. This is a sort of a showdown, shootout, lineup, company profile of Aqua Velva. So last time we took the Spanish Aqua Velva and the one you see most commonly in American stores, the classic ice blue, and compared those. And I gotta tell you, I monitored what the face feel was like for a few hours afterwards, and really the day after too. And I'll get to that in a second, but I also monitored the scent. In addition to, it's kind of hard to distinguish where the scents are coming if you have half of your face with one and half of the other. But I did do like the back of one hand with the Spanish one, the back of the hand with the classic ice blue. And what I did notice is that the scent lasted much longer on this one. It was somewhat of the skin scent, meaning you had to be pretty close to smell it, but really a couple, 3 inches off of your hand, you could smell it. So it still had some pretty good projection, I guess you would say, after, a couple of hours, as opposed to the Spanish one, which kind of dissipated pretty quickly in terms of scent. In addition, while the face feel on the Spanish one was a little more tacky, which would lead me to believe it might have some more moisturizing properties, the face feel with this one was much sort of cleaner, smoother. And I ended up having more ingrown hair type issues on this side than I did this side. And it could be that some of those moisturizing agents kind of clogged pores or something. But I'll be honest with you, I wanted to like this one better because of the glass bottle and because it's from Spain and not the US, meaning it's kind of, makes it a little bit more hard to come by. And off of the, out of the bottle, I tended to like the smell of the Spanish one a little better, but this one performed better long term. So we'll just see after we get through all of it. Now, last time I told you that we were going to this time do the Aqua Velva Classic Ice Blue against the Aqua Velva Musk, but I decided to put this one on the bench for a while. I'm going to call an audible. Omaha. Well, actually, Oh Canada. Because what we're going to do is we're going to the Aqua Velva Original Sport. I think that's what it's called, yes. Which you traditionally can only get in Canada. However, I got this one via my friend KJ, aka The Spider Shaves for the Shaving Cadre on YouTube. I'll link his channel below. So he had some of this and was nice enough to send me a sample. I also talked to some folks on Facebook that live in Canada. And they readily have it there, but I couldn't find any places where you could purchase it online and ship it to you. So thanks again, KJ, for sending me this. So in order for us to move quicker through this, I decided to set the ice blue on the sidelines and us have these two be facing off today. We're going to use the Dat Darn Rob Badger brush, green and orange or green and brownish, dark brown color, amber color. And so that's what we're going to use here today. It's been soaking. Sterling unscented pre-shave soap. Remember guys, if you happen to use a kettle to boil your water, make sure that your water gets down to around 120 degrees Fahrenheit before you use it. Just like last time, and keeping in tune with the focus on sterling, we're going to use the sheep unscented again, pressed out in this like pet food bowl, 99 cents from like Walmart. So we're going to get in here and load our brush. Okay, got some proto lather here on the bowl. Just take that, rub it in a little bit to the face. Okay, so during this shave, I want to talk to you a little bit about clinical depression in general, but also clinical depression in men more specifically. Now let's first start by talking a little bit about distinguishing clinical depression from sort of regular depression. And by that I mean that we all feel down or blue from time to time. And we all certainly will feel down or blue in reaction to significant loss, like the death of a loved one. But clinical depression is a more prolonged condition. It is classified as a disorder of mood, meaning for a certain period of time. And most people, the vast majority of people that become clinically depressed, can recover to their pre-depression functioning just quite nicely. For the majority of people with clinical depression, the treatments that are out there work really well. Now, clinical depression is sort of the garden variety of mental disorder, and I hesitate to use that phrase. I mean, that's the phrase that's used to classify the various mental illnesses that we can experience. According to at least the American Psychiatric Association, their Diagnostic and Statistical Manual of Mental Disorders. But as far as mental illnesses go, or mental health problems, we'll put it that way, depression is your most common one. It is estimated that, and this is through pretty solid epidemiological studies, that 1 out of every 3 Americans will face a clinical depressive episode at some point in their life. At any given time, there's around 10% roughly of the population that meet diagnostic criteria for clinical depression. So let's get a little bit into some of the symptoms for clinical depression. Now, before I get into that, you're familiar with my love for the Phoenix double open comb Ascension Twist copper razor. I had a viewer named Juan who sent me, he piffed me, and by the way, those of you new to the community, piff means paid it forward. He sent me for free his double open comb Phoenix Ascension razor in stainless steel. I'm actually not sure if this one's Ascension, like the twist adjustable, but anyway, it's the double open comb in stainless steel. Very generous. Thank you, Juan. I appreciate that. And so I'm just now getting around to using it in a shave. I have a Gillette Wilkinson sword on its second use. Just check our lather here one more time before we get into the shave. Now, it's important to note that when we're talking about clinical depression, in general, it's not diagnosed within 6 months of a significant loss. So like I said earlier, if you were to lose a loved one or have some other major loss in your life, it is absolutely normal to grieve, obviously, and people deal very differently with grief. And we can talk about that in a future video. But the reason that particular specification is there is to, sort of normalize for people that grieving can be very, very difficult. And generally, if you have suffered a significant loss recently, a clinician would be hesitant to diagnose you with clinical depression because it would be expected that you might still be grieving within that 6-month period. Now, for grief, and again, I don't want to get too much in that, things like birthdays, anniversaries, and then by that I mean anniversaries of the death, like a year later, holidays, are tough for people after a loss. So, it's pretty common to have that type of grieving within 6 months. So, now sometimes people will get stuck in their grief, meaning they're having a hard time recovering. So after that 6 months, clinicians are willing to consider a diagnosis of clinical depression. So some of the symptoms of clinical depression. Now, keep in mind, having one of these doesn't mean you're clinically depressed. You have to have pretty much the majority of these, and I can do a separate video where I get into the specific diagnostic criteria of how it's diagnosed, but I'm actually going to put some self-screening measures down in the comments area so that you can go out there and take a test for yourself if you think like you might be dealing with clinical depression, or refer a friend or a loved one to some of those self-assessments. As I said, just having some of these symptoms, like just 1 or 2, is not necessarily clinical depression. I actually need to load a little bit more. I didn't do a good job loading here, or I might have actually overhydrated. Let me get back in here and get some soap. Yeah. But having just 1 or 2 of these, more likely you're not clinically depressed, although you may be, experiencing a depressive episode. But in general, some of the symptoms that you might experience if you're clinically depressed is obviously you may feel a great deal of sadness. You may cry frequently. However, in men, the research has bore out that we will often translate our sadness into anger. And so men who are clinically depressed tend to be pretty irritable. And when they have something upset them, often they may not break down and cry, or at other times they may actually lash out in anger. And the thing is that what we know, at least clinically from in terms of therapy, is that depression and anger tend to be two sides of the same coin. A lot of times people have not learned to deal with their anger in a healthy way, and many of them, rather than express it in any kind of way, tend to stuff it. Many of us will sort of overlook certain things that make us angry. And over time, if we haven't processed those emotions, it can be a contributing factor to depression. So, sadness, irritability, sleeping more than usual or not sleeping as much as usual. So extremes in either direction. You're sleeping way more than you used to, or you're having a hard time getting to sleep. Same thing with eating. You may be overeating like you haven't before, or you may undereating. You may not feel like eating. One of the hallmark symptoms of depression is losing interest in things that you used to enjoy. So the things that used to bring you joy are just not enjoyable to you anymore. So sometimes even the hobbies that you usually enjoy will just not bring the same satisfaction or enjoyment that they usually would. By the way, that symptom is often called, at least in clinical circles, anhedonia. Kind of similar root word to hedonism, but this idea that you can't enjoy anything. Okay, good second pass. Let's go back in here and lather up for the third. If you have clinical depression, you also may be rather hopeless about the future. You may feel kind of trapped. You don't really see a future that well. In general, you're sort of losing your hope. You're also likely to be rather anxious and on edge. Now, the thing is about, again, mental health challenges we face, they can overlap. So depression and anxiety are not discrete experiences. They can overlap, and sometimes you can have both anxiety and depression. But usually one of them is the more predominant issue, and the one that you should address first. Now, with depression, you may also have increased physical problems, like more frequent headaches. Digestive issues are pretty common. Diarrhea, constipation, irritable bowel type of stuff. Stomach cramps. You may even feel more tightness in your chest, and sort of similar to what you would have with anxiety. And it's important to note that while women do this as well, men tend to do it more often than women, and that is we attempt to self-medicate our emotional challenges, whether they be depression or anxiety, or sometimes even anger we're not dealing with. And by self-medicate, well, we can do that a variety of ways. But the one I want to talk about initially is the use of alcohol or drugs. And trying to treat clinical depression with medications not designed to treat it long term is not a good idea. All right, before I rinse off to get to the post shave, I want to just briefly talk about suicide, and I want to connect that with the issue of alcohol and drug use to try to self-medicate depression. Using alcohol and drugs while you're clinically depressed can lower your inhibitions, and therefore if you've been having thoughts of suicide, it is much more likely that you might attempt. And men are actually 4 times more likely to die of suicide than women. And the rising rate among middle-aged men, particularly in the US, is alarming. And I'll dedicate an entire video to talking about suicide prevention in men and why it's a problem. But of all these symptoms I've kind of meandered through and mentioned, if you tend to deal with the majority of those, you might be dealing with clinical depression. Now again, I'm going to put some links to self-assessment instruments you can do online. You can go and take a confidential survey. They don't even ask for identifying information, where you can see if you meet diagnostic criteria for clinical depression. I'm also going to include the National Suicide Hotline number down below, and also give you a couple resources for helping others that might be dealing with depression. Now, I want to mention that on the National Suicide Hotline website, in addition to the 1-800 number you can call, and again, this is for the US, I'll provide other links to international resources. There is a chat box that you can actually chat with a counselor and talk. So you don't even have to call someone on the phone, and you don't even have to give identifying information. You can chat with someone confidentially that's there to help you in a crisis situation. If you would like to learn more about how depression is treated and what to do if you think you might have depression, stay tuned after the aftershave talk, and I'll give you a little bit more information about that. One of the areas that I did not mention in terms of symptoms, or at least I don't think I did, you can also tend to isolate yourself more if you're clinically depressed. You tend to withdraw from other people and try to be, you tend to be more isolated. Okay, let's get into the Aqua Velva stuff. I'm gonna tip my hand here a little bit and tell you that I love the way this stuff smells. This Aqua Velva Musk. It's a dark, ambery, musky, old school. This reminds me of the 70s and 80s, late 60s types of scents. Put a very generous amount here on the right-hand side of the point. I got a little bit in the mouth. I don't recommend doing that. I can tell you that it's also very powdery in scent. Got a little bit of a burn there, but not too bad. It smells great. This is very barbershop-y to me, not a traditional fougere barbershop, but that musky, powdery, amber type of thing. That's really nice. I really like this. Now, by the way, some of the people on the Facebook groups had mentioned that they tried to find this in the United States and can't find it. I found this one at a CVS at one point, but yesterday I was in my mom and pop grocery store. I live in a very small town, and was at the grocery store yesterday, and they had this one, the classic ice blue, and then the ice sport, all for like $3.48. And they tend to be a little higher than like drugstores or Walmart, but they had like 7 bottles of this stuff. And This one is the anniversary edition, which means it would have been 2017 because that would have been the 100th anniversary of Aqua Velva. But they had some newer bottles, but they still had one of the anniversary bottles on the shelf. Anyway, that one smells great. I like it. Now, let's get into the Canadian one, the Aqua Velva Sport, and I have it here in the, looks like probably a former like hotel shampoo or conditioner bottle. Put that, it's a challenge, by the way, putting aftershave on with one hand. Okay, this one's very fresh and green and minty. Very minty. A little bit like Skin Bracer. It seems to be some light, like slight herbal notes in there, but the face feel is similar. Yeah, these two are very different than the two that I used in the last shave. And again, I'm going to set a timer, see how the face feel is down the road, also dab a little bit on the back of the hands, check how long the scent lasts. I'm getting a lot more menthol from this one, from this Canadian one, the green one, the original Sport. And not so much menthol from the Musk. It's good moderate menthol there. I like that. And by moderate, I mean middle of the road. It's not weak. You definitely notice it, but it's not like, glacial level, to use one of Sterling's terms. Okay, so let's get back to the discussion real quick of what to do if you are clinically depressed. Let me first say that if you think you are clinically depressed and it's interfering with your life and you really don't know where to start, particularly if you struggle with thoughts of suicide, then you need to contact your family doctor immediately and go in and see them. Now, if you're actively considering ending your life, you need to go to your local emergency room. They're prepared to talk with you about what's going on and get you to the help you need. Now, I want you to understand that when you seek out mental health assistance, whether it be from your family doctor or from other sources, specifically like a psychiatrist or a clinical social worker or a psychologist or a licensed marriage and family therapist or a licensed professional counselor, there are laws, at least in the U.S., where you're not going to be committed against your will unless you are actively suicidal and are not seeking help and don't want help. And there's been a recent act that suggests that you are a threat of harm to yourself or others. So you really have no fear in going to seek help, because the fact that you're seeking help means that you're wanting to get help. And so while in some instances, and this would be rare instances, people who need help with clinical depression may be admitted to a hospital voluntarily. In the majority of cases, depression can be treated quite well on an outpatient basis. Now, let me mention this before we talk a little bit more about medical and talk therapy treatments. The research, guys and gals, is overwhelming on the benefits of exercise. Exercise, moderate to moderately strenuous exercise, is very beneficial, particularly if you can do it for about 150 minutes a week, right? So 5 sessions of 30 minutes a week, really beneficial. But doing some physical activity is better than none, and it is so helpful. The studies after studies after studies, they show that the exercise can be as effective as antidepressant medications for some people. So, I would suggest physical exercise, moderate walks, if you're not already physically active. Open the blinds in your house, let some sunlight in, try to stay hydrated. Try to get as much sleep as you possibly can. So hydration, sleep, exercise are very important. Also eating, a balanced and nutritious diet is important. But if you go to your family doctor, they're more than likely going to give you an assessment of depression, like they're going to ask you some questions or have you fill out a questionnaire to see if you might meet diagnostic criteria for clinical depression. Now, the two major ways that depression get treated are, one, through antidepressant medications, and two, through talk therapy or talking to a therapist or a clinician. Now, people usually use one or other of those or both of them. So there are actually people who have done well on treating clinical depression just by talking to a therapist and going for a number of sessions to work on their depression. Other people have done only medication. Some people have done both, and the most effective treatment is doing both. However, some people make it work with just therapy. I will say this, I would not recommend only medication. If you're going to get on medication, I would say also get on also start seeing a therapist. Now, you can certainly get on the medication to start with until you can get in to see a therapist, right? And let me tell you a little bit about sort of people seeking help or not seeking help. It's probably no shock to you that men, we are less likely to seek help. We're less likely to recognize that we're clinically depressed, and we're certainly less likely to seek help. The majority of people with any type of an emotional struggle that meets criteria as a mental disorder, the majority of them never seek help. Less than half, but it's right at half, of people with a mental disorder actually ever seek help. And then only a half of those that seek help seek it from a specialty mental health provider like a psychiatrist. So in other words, your family doctor may want to refer you to a psychiatrist, and that might freak you out a little bit. But think about it, like you're probably not going to have your regular, as we call it here sometimes, shade tree mechanic, your sort of jack of all trades mechanic, like change out your transmission. You're going to take your car to a transmission place, right, to a specialist. And that's what psychiatrists are. They study specifically psychiatry, and they've had to do additional years of residency and training beyond just the general medical doctor to have that knowledge and skill to help you. And they're going to be the ones staying up on the latest research and what the latest medications are. And in my experience, no offense to family doctors because they're great, but they have so many things to focus on. And when the drug reps come around talking about medication, psychiatrists have probably already read up on what they're talking about, where family doctors may have a more difficult time keeping up with the psychiatric research. Not to say that some don't. I'm just saying that you have a specialist as opposed to someone who's not a specialist. So, consider doing that. You could also talk to, like a pastor or, a priest or your rabbi about your feelings of depression and talk with them about that and see what they might recommend. I did my dissertation on the whole topic of how people of faith interpret mental illnesses, and particularly I looked a little bit at depression. And it's important to note that sometimes we have stigma as men about not wanting to seek help. We feel like we have to be tough, we have to be strong. That also sometimes exists in faith communities. While a lot of faith communities can be really encouraging and encourage people to seek help, sometimes people would look at depression as being someone who has weak faith, and that's just not the case. And I can talk in another video. If you're interested in me talking more about faith and depression, please comment below because I have lots of things I could add about that. But basically, yeah, if you think you might have clinical depression, take one of the tests below. Consider talking to your family doctor. Start exercising more, get sunlight, stay hydrated. Consider going on medication after talking to your doctor. Also consider seeing a specialty mental health provider if your doctor mentions that. But definitely I would recommend, if you do go on medication, to also see a therapist. I know a lot of people are reluctant to get medication, but think about it, guys. If you had high blood pressure, you probably wouldn't have as much hesitation to take high blood pressure medicine as you would antidepressants. The same thing is true for diabetes. Like if you need insulin, right? Our brain is an organ just like any other organ in our body. So we should consider that when we're thinking about getting help for a clinical depression. I'm sure there's a lot of things I wanted to say that I left out, but I will get back to this topic in several videos in the future. But yeah, just to wrap up the whole Aqua Velva thing, right now this one still has a good menthol feel. In the next video, we're going to move on to our final two contenders, if you want to call them that, in our Aqua Velva lineup. We have the Ice Sport and the Sensitive 5-in-1, which seems to be a popular product among wet shavers. I know I've actually started compiling all of the 5, 4, 3, 2, 1 challenge responses because I'm going to do a video on that at some point, is like tell you what products showed up the most often in people's list. But this one was one that occurred quite a bit, the Sensitive 5-in-1. So I'm looking forward to using this balm. It's not a splash, but a balm. So yeah, that's the two we'll do in the next shave. I'll set the timer, see how these do, make note of it, share it with you in the next shave. But until next time, take care of yourself, and I'll see you then.